Imagine your little one, usually so expressive, suddenly crying in a way that just does not sound right. It is quieter, almost like they are struggling to get the sound out. Could this subtle change in their cry be a sign of something more serious, like trouble breathing? Yes, a weak or unusual cry, especially when accompanied by other observable signs, can indeed signal breathlessness in a child. When a child struggles to breathe, their body diverts energy away from non-essential functions, including the full effort needed to produce a strong, robust cry. The core reason behind a weak cry indicating breathlessness lies in the mechanics of respiration and vocalization. Producing a strong cry requires significant muscle effort and a good volume of air moving rapidly across the vocal cords. When a child is breathless, their lungs and airways are working harder just to take in enough oxygen and expel carbon dioxide. This increased respiratory effort leaves less energy and air volume for vocal projection. Essentially, the body prioritizes getting oxygen over making a loud sound, resulting in a feeble or strained cry. This physical limitation means they cannot generate the force or breath support for their usual vocalizations. To tell if a weak cry is linked to breathlessness, observe your child for additional critical signs. Look for rapid or unusually slow breathing, flaring of the nostrils with each breath, or visible retractions where their skin pulls in between the ribs or at the base of the neck. You might also notice a bluish tint around their lips or fingernails, which indicates a severe lack of oxygen. Pay close attention to their overall demeanor. Are they lethargic, unusually quiet, or struggling to feed? These accompanying symptoms, when paired with a weak cry, form a clearer picture. Recognizing these indicators early is crucial. The term medical professionals use for significant breathing difficulty is respiratory distress. Visible retractions, like substernal retractions where the skin pulls in below the breastbone, or intercostal retractions between the ribs, are direct physical signs that your child's body is working overtime to breathe. A weak cry often represents a late sign of respiratory distress, meaning the condition could be worsening. Understanding these specific visual cues helps you act quickly. Ultimately, a child's weak cry should always prompt you to look for other signs of breathing difficulty. It is not just the cry itself, but the full constellation of symptoms that tells the story. Trust your instincts, and if you suspect your child is struggling to breathe, do not hesitate to seek immediate medical attention. Your prompt action can make all the difference in ensuring your child receives the care they need for optimal well-being.